Start.
Hello,
Hello.
this is Dr. Rabla, doctor in the medical admission unit. Are you Mr. James Bond, 24-year-old?
Yes, doctor, I am.
Nice to meet you, sir.
Nice to meet
We
you,
are here
doctor.
today to discuss your condition and to examine you and what we can do for that. Is that okay with you?
Okay, doctor.
So I understand from the letter that you have some joint pain. Can you tell me more about it?
Yes, doctor. For the last few days, I suffered from pain in my ankles, in my knees, and sometimes I feel that the pain is sometimes in my ankles. Then it becomes better, and then again it affects the knee. I think it is somewhat running pain. I took
Hmm.
some paracetamol tablets and some over-the-counter medication that helped me a little, but I think that it is not going away totally. So I visited my GP, and he thought that there might be something abnormal. He sent me here.
Is it one joint or both side, both leg, one leg or both leg?
Both leg, doctor, but sometimes it is on my right side, sometimes it is on my left side, like this.
And before these 2 days, do you have similar condition before?
No,
Similar episode?
not 2 days, doctor. It is for last few days, maybe for 4 or 5 days.
And have you suffered anything before that? Is there any specific thing like fall or
No,
injury or anything?
no,
And it come all of sudden or gradually?
suddenly.
It start first in your knee, then went to your ankle.
Yes,
Do you have any swelling in your joint?
no,
No swelling at all.
no,
And any redness, any change in the color,
no.
any raised temperature in the joint.
I think it is somewhat uh, warm than other area.
And when you have the pain, you have any problem in movement of the joint.
No, but I feel better after some movement.
So when it's do you have any stiffness at morning?
I think a little bit about for half an hour.
And the joint pain improve by time.
Yes, but present all the time.
And and does it improve by movement
Yes,
and worse by rest?
yes, doctor.
Okay, I'm sorry about that. Otherwise, you have any other joint problem other than ankle and
Oh,
knee?
no,
Any problem in your spine, in your back, lower back or neck?
no.
Okay. Yeah, Mr. James, do you have any problem in your skin?
Yes, doctor. That is also for a recent times. I noticed some rash over my palm and over my sole.
Can you describe the rash, please?
Some blackish and sometimes little bit painful also, and also some
When does it
somewhat fluid
started?
filled.
When does it started?
That is also for last 2 to 3 days.
And it comes suddenly or after injury or anything or
No,
exposure
I'm
to
thinking
any.
suddenly.
Mm, you have it doesn't expose to liquid or anything
No,
or any injury.
no,
Okay, and is it getting worse or improving?
getting worse, doctor. I think it is spreading to other parts of my body,
Which part?
on my chest, on my hands, upper part of my hand.
And it is blackish in color.
Yes, doctor. blackish, and
and
sometimes fluid.
and full with fluid,
Yes,
and does it itch?
little bit.
Okay. Do you have any other skin problem at any part of the body?
No,
Do you have any skin problem when you expose to sun?
no,
And when you scratch your skin, does it come also in the place of scratching?
no,
Do you have any problem in your hair, losing of your hair or scarring in your hair
no,
and behind your ear?
no,
Any sore in your mouth?
no.
Any sore in your sensitive area?
Yes, doctor. I had this around 3 weeks ago, but
What have,
it healed on its own.
where exactly in the organ itself?
Yes, doctor.
And do you have any abnormal discharges from the organ?
That was present about a month ago.
Hmm. And for how long it stay?
Uh, 3 or 4 days.
And what is the color of discharge?
White.
Okay, and there was any fever that time?
Yes, doctor.
Any pain while urinating?
Yes, doctor.
I'm sorry to ask, but it helped me in the diagnosis, and it will be confidential. Do you have any part-time relationship? Relationship
Yes, doctor.
with whom?
I am doctor certain other type. And I have quite few boyfriends.
Can I ask if you have with girl or with man or woman?
Men,
And is it protected or you?
not all
Mr. James, uh, do you have any problem in your eye?
I had doctor, but it has resolved. And also the problem in my eyes that was also about 1 month ago. I had some redness in my eyes.
And does it affect vision?
No,
And it goes alone
yes, doctor.
in both eye or one eye?
Both eye.
Okay. Do you have any problem in your muscle? Any muscle weakness? Any
No,
muscle pain? Any skin changes otherwise?
no,
Okay. Can I know if you have any previous medical problem?
no,
Do you take any medication?
no,
Do you have any allergy to any medication?
no.
Do you use over-the-counter medication?
For my pain, I took some paracetamol and some ibuprofen.
I'm sorry to ask, but do you use recreational drug?
Sometimes, doctor.
What type of drug?
Bloods and through my bloods and I take some morphine.
Do you use single-use syringe or shared syringe?
Share the needle. All the time I cannot afford myself.
Can I know with whom you share the syringe?
I usually share whom I can make friends. They are not sometimes the known person.
Are you aware of anybody of them having any disease
No,
spreading? When- Okay. Have you ever admitted to the hospital?
No,
Any previous operation?
no,
Any family history of note?
no,
And do you have any previous history of infection with what we call hepatitis B, C, or even HIV?
no, doctor.
Can I ask if you smoke?
Yes, doctor. 10 minutes
Uh,
past.
how how many cigarettes and for how long?
10 to 15 sticks a day for last about 8 years.
Mr. James, I advise you to stop smoking because it's injurious to health. And if you want, I will help you with referring to smoking station clinic. Is that okay with you?
Okay, doctor.
And do you drink alcohol?
Yes.
How much you drink?
Whenever I can afford, doctor. It's not quite fixed.
Mr. James, there is limit for use of alcohol. It should not exceed 14 units per week. I advise you to modify your consumption of alcohol because it affects the liver and other parts of the body. Is that okay?
Okay, doctor.
Okay. Can I know what do you do for living?
I do part-time jobs, doctor, not in a fixed job.
Okay. And does this condition affect your job and daily living?
Yes, doctor. I'm having some problem because as I do part-time jobs, I cannot do the job with my condition.
I can refer you to social service and occupational service. They will help you with this regard. Is that okay with you?
Okay, doctor.
Mr. James, I would like to go through some question regarding your symptom. It helped me with diagnosis. Is that okay?
Okay.
Okay. Do you have any problem with water work?
Not now.
Do you have any burning when you pass urine?
Not now.
Any blood with the urine?
No.
Do you have any problem with the bowel or
No.
hard stool or loose stool?
No.
Do you have any tummy pain, tummy ache?
No.
Do you have any chest pain?
No.
Do you have any racing or pacing of your heart?
No.
Do you have any cough at all?
No.
Do you have any noisy chest?
No.
Do you have any shortness of breath?
No.
Do you have headache?
No.
Any history of fits or shaking of your hand?
No.
Any weakness in any part of your body?
No.
Any lump? Do you have any raised body temperature?
Yes, doctors. Sometimes I feel feverish.
Recently, you have this high body temperature?
No.
Do you measure it?
No.
Uh, do you have any sweating?
No.
Any change in your weight?
No.
How is your appetite?
I think it is quite good.
Any lump or bump on your body?
Some rash over my hands, not otherwise. No other lumps.
Any weather preferences?
No.
Okay. Um, can I examine you, Mr. James?
Okay. This is a surrogate, but you can examine.
Okay, I will take a look if he is underweight or cachistic or the nutrition status. Any problem?
She is underweight.
Is there any pillar or jaundice?
No.
I would like to examine the hand if there is any joint problem in the hand.
No.
Check the pulse.
90 beats per minute.
I'll check the arm for any needle injection.
Yes.
I will I will see the area of any infection there or any
No.
problem. I'll check if any skin rash in the hand.
Yes. There are some papular
How
rash.
can I describe it?
Papular rash over the area with
Is it
some scaling.
is there a hemorrhage inside?
A quite few.
Any fluid inside?
Very little.
Is it tender?
Yep. Mild tenderness, but not severe.
I is it in both hands?
Yes.
I'll check for any lymphadenopathy in the
No.
underarm and the neck.
No need.
I will check the heart if there is any murmur.
No.
I will check the abdomen if any organomegaly or any tenderness.
No.
I will check the lower spine if any tenderness.
No.
I will check the knee joint if any problem.
Yes.
What is the problem there?
Knee joint is mildly swollen. Temperature is mildly raised.
Is there fusion inside? Sign of a fusion, batellar sign is positive.
No patellar sign, but a little bit swollen.
Is it in one knee or two knee?
Left side of the.
Left side. Is there tenderness there?
No.
Any skin rash above it?
No.
Movement, passive movement of the knee?
No.
No problem in the passive movement. No
No. No problem.
limitation. No crepitation,
No.
and no tenderness.
No.
No hotness.
No. Oh, or
Uh,
mild increase temperature.
the ankle joint, any problem?
No.
Any skin rash anywhere?
On the sole of the foot.
I would like to complete my examination by examination the genitalia area, if it is okay. Okay, what is your concern, Mr. James?
Why I am having this, doctor? Is it something serious?
I
Time off.
appreciate your concern. I think.
So have you reached your diagnosis?
It is the differential diagnosis, top of the differential reactive arthritis secondary to urethral infection, most likely ge- gonorrhea or herpes, chlamydia.
You mean
In
gonorrhea,
my
gonococcal infection?
yeah,
Okay.
other differential, I should roll out HIV.
Okay. So how will you investigate him?
Investigation. We'll do a basic complete blood count, inflammatory marker, liver function test, renal function test, electrolyte. We'll do blood culture, urine culture, chest X-ray. We will do after counseling the patient, we'll do HIV serology and hepatitis B and C. We'll check for chlamydia and gonorrhea and serology. We'll do X-ray of the knee and ankle and to see any changes. If there is suspicion of effusion, we'll do aspiration and analysis of the fluid and culture and gram stain. And we'll
Okay, very good. How are you managing?
a patient need admission, we'll start antibiotic for the infectious knee infection, and we'll follow up with the culture result, and we'll give IV fluid and follow up the need of treatment if there is evidence of HIV or any transmitted disease.
Okay. I think you should involve the infectious disease doctor.
This is the same mistake last time. I should make multidisciplinary team, including my consultant, infectious disease doctor, the joint doctor, occupational therapist, and physiotherapist. Patient need rest also, and the treatment.
Okay. So, do you think the reactive arthritis is a clinical diagnosis or diagnosis after investigation?
It is a clinical diagnosis.
Okay. So, what type of painkiller are you going to suggest him?
If there specific to painkiller, you can use paracetamol or NSAID.
Okay, fine. Thank you. Done very well.
We should do also HLB 27.
That is a plan. This is a non. This can be rheumatoid factor that it is a seronegative arthritis likely. And I don't think that this patient needs admission. Okay.
If there is septic arthritis, need admission, right? And he is
Septic arthritis.
unwell.
Septic arthritis is a possibility, but you can observe him.
And he is unwell. He is look unwell, right?
He's a IV medics, IV drug abuser. So you can observe him. You can start the medication, and after the results come, you can give the decision on that. Okay, I don't have anything to add for this gentleman. You went for everything well. But just one thing that whenever asking about the private questions, just becomes somewhat more tactic. You asked me straightforward. Just like that, okay, I need to know something very personal from you, and I think it is related to your condition. If you don't mind, can I go for your very personal question? Can I ask you a few question about your sexual life? Okay.
I make some introduction that excuse me, I will ask you some personal question. It help me with the diagnosis.
Yes. And then ask him that I am going to ask you few personal question about your sexual life. Okay, so that he will give idea, or he will get idea that he is going to ask very personal question. Or after asking the personal that I am going to ask you personal question, then you go for the sexual cases that will embarrass the patient. And you once said that do you feel any pain during urinate? You can say that do you feel any pain during passing your water?
Mhm.
Urinate is a medical term. Okay.
Uh, is this skin lesion you mentioned the classic one for writer?
Keratoderma belanuresica.
It looks odd for me.
Keratoderma belanuresica.
Keratoderma. Is this classic presentation?
Yes.